Then is a demonstration of putting together a local anesthetic syringe. You can see there's two different syringes you can choose from. There's a self-aspirating syringe where in the barrel, if you look at the barrel, it's smooth, there's no harpoon. And then the aspirating type syringe that has a harpoon. So in the barrel there is a harpoon plunger there. So in order for you to be able to tell the difference between a self-aspirating and an aspirating syringe would be in the harpoon. The harpoon being the aspirating syringe and the non-harpooned in the barrel being the self-aspirating syringe. So Sylvie's going to do a demonstration on how to put together a syringe. We're going to select a self-aspirating syringe. So she's checked the barrel to ensure that it's flat, there's no harpoon. We have already determined the type of anesthetic we're going to use. And remember, the type of anesthetic you need to use has to be determined by the dentist in terms of whether or not there's epinephrine or a vasoconstrictor in that or not. We want to make sure the cartridge is clear and not cloudy, the cartridge is not cracked, that it's not expired. So you want to check the expiry date, that it hasn't been previously frozen and cloudy in any way. So knowing that the cartridge is the correct type of anesthetic and also is a current anesthetic with no cracks or possible defects in the cartridge, we've inserted the cartridge into the barrel. So cartridge goes in first, and now we're going to select the needle. The size of the needle will be determined upon the area that's being anesthetized. If we are doing a block injection, typically on the mandible, we will use a long needle. Okay, so the longer needle, 1 5/8 of an inch, I believe, long. There's also the gauge of the needle, whether the thickness of the actual needle will also be determined by the length of the needle. You're screwing the needle on to the hub of the syringe. Okay, the short needle is 1 inch long in length, okay, and when you put them up against each other, you can see that one needle is slightly longer than the other, even with the protective cap on it, okay. So the needle is screwed onto the hub, and the syringe then is all put together ready for passing to the dentist. Prior to passing, you want to loosen the protective cap slightly, okay, so that it is loose enough so that when you pass it, you can remove the protective cap. So now we'll demonstrate actually passing of that instrument, that syringe. You're going to take the syringe. You want to make sure the thumb ring is going to be adapted into the dentist's thumb. So you'll place it, and once it's placed, you'll remove the protective capping that you've loosened, and the dentist then will proceed to do his inferior alveolar nerve block on the mandible. And once the injection's been completed, then he will either place the syringe back on the counter, or some dentists may elect to pass it back to you. And this is where it becomes very critical that you're taking that syringe back away from the needle so you're not causing yourself a needle stick injury. This is very dangerous, so you have to be very careful when you're retrieving the syringe. And then when you're recapping, you're going to scoop the cap into the needle, okay, to be able to recap that needle. Once the procedure is completed, you want to remove the needle first. So you unscrew the needle, and you're going to dispense of that needle in the sharps container. Okay, so put back the back, put it into the sharps container, and then remove the cartridge and also dispose of it into the sharps container. And then you can take your syringe and disinfect your syringe and then prepare it for sterilization for reuse again. And that concludes the topical anesthetic or local anesthetic video.